Welcome to another episode of the News Roundup. On today's show, we're going to be talking about the World Health Organization's recent discussion of the COVID-19 vaccines and a rare potential side effect of hearing loss and tinnitus. We'll talk about what the WHO said on this issue, as well as link to the report in the description below. And so, from Trial Site News, I am Adrian, and our episode is starting right now. Earlier this month, the World Health Organization, or the WHO, reported in their World Health Organization Pharmaceuticals Newsletter that the Global Health Agency is investigating what appears to be safety signals associated with the COVID-19 vaccines. Specifically, the World Health Organization investigated hearing loss as well as ringing in the ears as a possible rare side effect associated with COVID-19 immunization. In reviewing expected numbers versus actual reports of individuals who complain of hearing-related problems after receiving the SARS-CoV-2 inoculation, researchers found hundreds of accounts across 10 nations involving the two mRNA-based vaccines, Pfizer's BioNTech and Moderna, as well as an association with the AstraZeneca vaccine. Of course, the connections to the loss of hearing and tinnitus haven't been fully proven as of yet, and many experts in the field have already taken the step to assure the masses that even if associated with the vaccines, it is still extremely rare. With a possible causal association between the COVID-19 vaccination and auditory issues, the WHO is recommending more study into the topic as well as appropriate alerting to healthcare professionals. In the summary within the World Health Organization report that dealt with COVID-19 vaccines and hearing loss and tinnitus, it said that a recent signal detection activity at the Uppsala Monitoring Center, or UMC, identified hearing loss, including sudden cases, and tinnitus following COVID-19 vaccination as a preliminary signal to be further addressed. Up until February 22nd of 2021, there were 164 unique individual case safety reports, or ICSRs, which reported hearing losses, and 367 ICSRs which reported tinnitus with COVID-19 vaccine in the WHO Global Database of ICSRs. The cases were from 10 countries and most had no comorbidities. Time to onset varied between 0 and 19 days with a median of 1 day. Based on well-documented cases, alternative causes were not identified for most of the patients, although some may have had contributing morbidities like allergies, high blood pressure, prior hearing loss, autoimmune-related disorders, etc. The most common co-reported symptoms were tinnitus, followed by headache, dizziness, and nausea, and many patients experienced quick recovery, while some needed steroid treatment. A plausible mechanism of action involving the vestibulocochlear nerve has been suggested, and renewed search was conducted on November 18th of 2021. The WHO report also said that awareness of this possible link may help healthcare professionals and those vaccinated to monitor symptoms and seek care as appropriate. As there is still only limited data in the literature providing evidence for this link, further monitoring is required. Interestingly, by December of 2021, the global pharma company Johnson & Johnson included tinnitus as a possible COVID-19 vaccine side effect. However, Pfizer-BioNTech and Moderna have failed to include any mention of this condition associated with hearing loss. Interesting. Meanwhile, according to one local report in Arizona, one such person who suffered from this side effect, a Mayo Clinic vaccinologist, Dr. Greg Poland, developed tinnitus himself after he received the COVID-19 vaccine. He noted that the WHO report is a first step towards helping patients and said that if we want to have a vaccine confidence, we have to be transparent in all that we do, and that if there are concerns over these issues, then the best thing to do is understand them and their relationship. Despite unanswered questions about his ongoing ear ringing, Dr. Poland still recommends that people get vaccinated. In any case, it is also worth noting that the World Health Organization research found that more women than men reported hearing changes, with the median onset being 1 day. Researchers said that people who reported these potential side effects tended to be young, healthy people. The median age was 49 for hearing loss and 48 for tinnitus. For those who aren't familiar with what tinnitus is, it is a ringing in the ears that can be best described as hearing sounds in the head with no external source. And, as I mentioned at the beginning of this episode, we will provide a link in the description for the World Health Organization report so that you can read it yourself if so inclined. And of course, we'll be keeping you posted on this story as it continues to develop. And that, my friends, brings this episode to a close once more. As always, thank you so much for joining me on the show today. From Trial Site News, I am Adrian, and I will see you all next time.